What is your first therapy session like? In that first session, your therapist has to write what's called a diagnostic assessment. This is where they're going to be asking a lot of questions about your childhood, your relationships, your identified problem, what brings you to therapy, what your goals are, your medical history, your therapy history. It's a very, very in depth document that's really meant to kind of get a snapshot of how things are for you and what the problem is. It's not uncommon for a therapist to have a notebook out or their laptop out where they are taking notes for that diagnostic assessment. They're trying to get a picture of what all of your symptoms are and see if there's a diagnosis that fits you. That diagnosis is necessary for billing your insurance for therapy. The first session is also a great time for you to be asking questions, trying to decide if they're actually a good therapist fit for you. There will also just be some general rapport building, talking about what you like to do in your free time, what some of your coping skills might be, that sort of thing. There also might be some housekeeping items where maybe you're talking about payment information, talking about insurance benefits, that sort of thing. I think a lot of people go to therapy for their very first session and they're expecting that they'll walk away just like, oh my gosh, I got to get so much off of my chest and that was so stellar. And while it can be, it's often just a lot of logistical information. And a lot of the therapeutic work actually happens in later sessions after you've gotten all of those housekeeping items out of the way. What questions do you have about your first session? Let me know in the comments.